Have you ever had your plastic surgeon ask if you're single while you're under? I was getting a rhinoplasty to fix my deviated septum when things took a turn I never saw coming. Dr. Fitzgerald had been recommended by 3 different friends, all raving about his skilled hands and professional demeanor. During our consultation, he was nothing but clinical, showing me computer models of my potential results and explaining the procedure in detail. I felt completely safe. The morning of surgery, his anesthesiologist, Dr. Ruiz, prepped me while Dr. Fitzgerald reviewed his notes. As they administered the twilight sedation, I felt myself floating in that weird space between conscious and unconscious. That's when I heard Dr. Fitzgerald's voice. Different now, casual and unprofessional. She's pretty cute. Is she single? Through my fog, I heard Dr. Ruiz laugh nervously. That's inappropriate, man. She's your patient. I'm just saying, look at those eyes. Once this nose heals up, she'll be stunning. My heart was racing, but my body was paralyzed. I couldn't move, couldn't speak, just forced to listen while under their complete control. You need to focus on the surgery, Dr. Ruiz said firmly. This isn't cool. Relax. She can't hear us. They never remember anything from this stage. Dr. Fitzgerald chuckled. I saw on her forms she's an architect, smart and beautiful. Think she'd date a doctor? I wanted to scream, to get up and run, but the medications held me prisoner in my own body. The surgery hadn't even started yet, but I was already trapped. Dr. Ruiz must have noticed something in my vitals because he suddenly said, her heart rate is elevated. I think she might be aware. Impossible, Dr. Fitzgerald dismissed. She's under. Probably just pre-surgery anxiety manifesting physically. They proceeded with the surgery, and I spent the next 2 hours in a nightmare state, feeling pressure and hearing tools but unable to communicate my awareness. Dr. Fitzgerald kept making comments about my appearance, wondering aloud about my relationship status, even mentioning he'd looked me up on social media before the surgery. When I woke up in recovery, the nurse asked how I was feeling. I immediately asked for her supervisor. When I reported what happened, insisting I'd been conscious for those comments, the supervisor looked skeptical. Patients often have vivid dreams under anesthesia, she said gently. Dr. Fitzgerald is our most professional surgeon, but I knew what I'd heard. I demanded my surgical records and recordings if they existed. That's when Dr. Ruiz surprised me. He came to my recovery room after his shift and handed me a USB drive. Operating rooms have audio recording for legal protection, he said quietly. I saved a copy before anyone could delete it. What he said was completely unethical. I've already reported him to the medical board, but you'll need this for your case. The recording was worse than my memory. Not only had Dr. Fitzgerald made those inappropriate comments, but he'd also instructed a nurse to include his personal cell number in my discharge paperwork in case she has any questions. He'd taken photos during the surgery that weren't medically necessary, focusing on my face from angles that had nothing to do with the rhinoplasty. I filed complaints with the state medical board, the hospital, and got a lawyer. During the investigation, 3 other women came forward with similar experiences. One had woken up to find Dr. Fitzgerald had written his number on her discharge papers. Another discovered he'd been telling staff he was dating her when she'd only been his patient. The hospital tried to settle quietly, offering me a significant sum to sign an NDA. I refused. This wasn't about money. It was about stopping a predator who used anesthesia as cover for his behavior. The medical board review revealed he'd been accessing patient social media profiles from hospital computers, specifically looking up relationship statuses and personal details of attractive female patients. Dr. Fitzgerald lost his medical license after a 6-month investigation. The hospital implemented new policies requiring 2 staff members present during all procedures involving sedation. Dr. Ruiz became the head of a new patient advocacy committee, ensuring scenarios like mine could never happen again. During the legal proceedings, I met 2 of the other victims. We started a support group that evolved into an organization advocating for patient rights during medical procedures. We pushed for legislation requiring consent discussions about recording rights and mandatory reporting when staff witness inappropriate behavior. My nose healed perfectly, ironically, but the psychological trauma took longer to process. I still panic at the thought of any procedure requiring sedation. When I needed dental surgery last year, it took me 3 months to find a practice that would let me bring my own patient advocate and record the entire procedure. Dr. Fitzgerald tried to rebrand himself as a medical consultant, but we made sure every potential employer knew about his history. Last I heard, he was working at a vitamin supplement call center, far from any vulnerable patients. Sometimes I get messages from women thanking me for speaking up, saying my story gave them courage to report their own experiences with predatory medical professionals. The USB drive Dr. Ruiz gave me sits in my safety deposit box now, a reminder that even in our most vulnerable moments, there are people willing to stand up for what's right.